So a child is in the department but needs an x-ray. And she has found one of our little type cars. You know, everybody's seen them. We have a couple of them over there that Child Life was nice enough to bring us. The kids absolutely adore them. So the tech comes over to get the child for the x-ray, and the child doesn't want to go. So he starts to, ask the mom to get the child out, and she starts howling. And you know what the tech does? Says, just let her drive it over to radiology. So they go down the hall with her driving her little car to get her x-ray. Now that's a whole lot nicer for that child and for that mom than in most places where they would just be picked up and hauled off to x-ray and brought back. And it really represents the kind of employees we have and how sensitive they are to kids' needs and how cognizant they are that in fact they are very different from adults. So I have lots of different stories like that. Child Life has been down there on occasion and helped with sedation and alleviating some of the anxiety. And that's clearly one of my goals, is to get a Child Life worker in the emergency department. It's another tool, it's another way to make this experience less stressful for the kids. Also, by bringing us back over to the North Tower, we will be much closer to our consultants, to all the other pediatricians, to the pediatric surgeons, the neurosurgeons. Yes, they come over here and they're very good about it, but it's a lot easier for them to bop up and down a floor or two than to hike across the way. And I can't help but think that that the collegiality that develops between us and those admitting services will be much improved by the physical locality that we have across the way. I also want to emphasize that I can't do this alone. The nurses can't do it alone. It takes everyone in here. It takes everyone that works here. And for all of your departments, whether you contact with us directly or indirectly, when you're asked to do something, the labs, when you get specimens, think about where this blood came from, And that's some little kid who's been held down probably and had the blood drawn. And think about if it were your child. Treat it as if it were your child. And that's sort of the type of experience that we want to make, and we want to incorporate everyone here towards a common goal and a mission to provide the absolutely best medical care that we can, but also the best caring that we can, not only for the child, but for the family. I also would like to say that we are trying to make very much a one-stop shopping for those of you that have children, and use Peds after-hour physicians. So that's all the CMS kids that are here for our faculty physicians and the private pediatricians in the area. Peds after hours will be moving into the physical area that we are, so that hopefully the children will get used to coming down to Shands and coming into that area. So when they need to come for an injury or an acute illness that can't be handled there, hopefully they'll be a little bit more comfortable with it. I would encourage you too to talk this up. No matter how big a campaign you have for PR and marketing, where do you get your advice? When you move to this area, where did you find your pediatrician? Probably from a friend, a coworker. You said, hey, who do you go to? And that's inevitably, especially in a small town like Gainesville, that's how things grow, by word of mouth, by passing it along, saying, we've got this great new building, facility, a wonderful program. Why don't you try it out? Because I can guarantee you, we truly are the only place that takes care of super ill children in this area. And Ocala, any child that's very sick gets sent up here. North Florida, anybody that needs any subspecialty service, sedation, anesthesia, any of those gets sent down here. So we're hoping to build a unit that it's natural for people to come to first. My kid's sick, oh, I'm going to go to the Shands Peds ED. And it saves that whole time that they've been and spent in another location. We will have one phone number that's easy to remember, 265-KIDS. So, it's a sort of a catchy phrase, and hopefully when parents are worried, sick, nervous, they at least don't have to go digging through the phone book to find the number, but it'll be, out there for them to use. Anybody have any questions, any comments? I hope I've shared a lot of my passion for this. I think it's going to be phenomenal. Shands has given me an unbelievable opportunity, and I truly never thought I'd see this day come. And I'm very grateful. Facilities has been terrific. We already have a donor that's given us you'll love it, 4 by 8 foot fish tank It's going to be great. It's got saltwater fish, and it's going to have Nemo in it, and you know, again, another thing that will help the children feel a little bit more at ease in coming to the ED. Yeah.
Jennifer, you know, my background, I've worked in a lot of places. I've worked in nested EDs, I've worked in solely adult EDs, and I was a nurse manager for pediatric ED, and there is a significant difference in all three of those. And we need this desperately. It's a mark, it's a different way of doing things.
It's just totally different. And I think you see it in everyone that works in a PEDS. I mean, it's just the vibe. If you go into a children's hospital, the vibe is completely different than an adult hospital. And yeah, some of it's the things on the walls or the decorations, but a lot of it's the kids, you know, and how people interact with the kids and how they interact with the families, and realizing that that child is not just your only patient. You know, you have this big extended family. You have all the other brothers and sisters who are by this time pretty upset because their bubby's getting an IV, you know, and he's having to get shots. And so those kids are upset, and you have to recognize that. And I'm committed to building that. I encourage, if any of you all have any issues, if you hear any stories, if you want anything investigated, let me know. Because I think we're getting together a group of people that are really committed to this. Shands has committed to this, and we want to make it very, very special. Yeah.
This is kind of probably shows my naivete when it comes to clinical issues, but where is the line between pediatrics and adults for, like, if you're in an ambulance, let's say my grandson who's what, 14, 16, 18, somewhere in that zone.
Where does it come? Most PEDS handle under 18. So 17, 354 or 5 days will come to the PEDS, and that's going to be our age here. There are a very, very few that up it through 19 or 20, but for the most part it's under 18.
Some of them are even 16.
Some of them are even 16. And peds surgery in the past has sort of had a 16-year-old cutoff, but they have now committed to serve as our consultants for all of our kids, irrespective of age. And again, you know, pediatrics is special. These kids have physiologic differences, psychological differences, developmental differences, and you have to recognize that and what stage they're in their development when you're explaining things, because boy, they interpret things just ways that you would have never thought. You know, I mean, one child came in and truly thought his arm was going to be cut off. You know, it was pretty ugly looking. It was like this. But his concept was that this arm was all broken and we were going to cut it off. So you have to be aware of where they are in their own development, and whether they verbalize that or not, at least reassure them, you know, that he's going to go home intact. And he'll get a pretty cast and nice colors that he can write on.